So Dr. Platt has been doing this for a long while, and he's going to tell you a little bit about his practice, what he's done, and then we'll go right into his presentation. Dr. Platt, are you there? Okay, we're going to unmute you, Dr. Platt. Are you able to unmute?
Okay, I think we, can you hear me now?
We can, we can.
Okay.
We can.
I guess what we're going to be talking about today is adrenaline, which is a hormone that most people have heard of, but it's also a neurotransmitter. And what people really don't understand is that excess adrenaline is the underlying cause of many conditions, and many of them are felt to be incurable. And so we're going to be talking about why we put out a lot of adrenaline and the conditions that are related to it. And just as importantly, what can be done to lower adrenaline. I know that if my understanding is correct, you do deal a lot with emotional type or mental illness type illnesses. And adrenaline is a big part of that. So I don't know if I can,
share screen, you're already on share screen.
Yeah, so I don't know if I can move the I'm just trying to figure out how do I change the slides here. Okay.
Oh, okay, so that's on your end. I think there should be a button that says go to your tap right.
What's this recording? Well, something, did you do that?
No, I didn't. You did that. You did that.
Okay.
So it's okay.
Yeah, we're not going to go, there's a lot on these slides, so we're not going to go over everything, but people really have to be aware that it is a crisis in this country, this excess adrenaline. And so what we're going to, one of the aims of this presentation is so that people can learn how to get themselves better without relying on their doctors, because doctors are not trained to treat the cause of illness. They're just trained to give out Band-Aids. And they have very little training in hormones, even though hormones control every system in the body. So, so let me, I don't know how I changed the...
I think you just clicked it and it goes, there you go. So,
okay. So
maybe if you slide the mouse, it may go to the back.
Okay.
If you slide it to the left, because you, yeah. Okay. Yep.
Okay. But anyway, the reason, the reason why the body puts out adrenaline, it's mostly known that when people are in danger, the body pours out adrenaline. But danger is a very rare reason why the body puts out adrenaline. The primary function, the primary reason why the body puts out adrenaline is actually to raise sugar levels for the brain. And what most people do not realize is that the brain uses more sugar than any other tissue per weight in the body. And anytime the body detects that there's a drop in sugar in the brain, it just simply puts out adrenaline. And this is this is something that can go on all day and all night. In fact, adrenaline peaks at 2:30 in the morning, and a lot of people wake up at that time. So the reason why the body is put into a position that the brain is low in sugar is, for example, the body might be producing too much insulin. Insulin is the hormone that lowers blood sugar levels. Insulin peaks between 3 and 4 in the afternoon, and that's why a lot of people get sleepy at that time, because remember, it lowers blood sugar. And a lot of people get sleepy in a car, which is also related to low blood sugars. So one of the reasons why the body is in a position where it needs more sugar and more adrenaline is too much insulin. And also the other thing is that it's very important to understand that the brain uses 2 different fuels. One is glucose. That's the type of sugar that it uses. And the other fuel the brain uses are ketones. And so if people are in a position where they're eating, but they're not providing the right amount of fuel for the brain, then they're going to be living on adrenaline. Now, there's another condition, and this is not common, but it happens. It's called type 3 diabetes. Everybody's heard of type 1 and type 2 diabetes, but there's a type 3 diabetes, which is insulin resistance in the brain. And this is where the insulin in the brain has a real hard time getting sugar into the brain cell. Now, why it's important to be aware of type 3 diabetes is that it's the #1 precursor to Alzheimer's. And you may have heard that coconut oil can actually cure Alzheimer's disease. And the reason for that is that coconut oil is a great source of ketones. And ketones, remember, is the other fuel that the brain uses. And ketones go directly into the brain. They don't need insulin. So the, I don't know how to go backwards because I missed a slide here. Oh, here we go. Oh, okay. I'm going to talk about people that have, and how excess adrenaline relates to them. The first we'll talk about, he's the head of a company. He's on high blood pressure pills. He's on antidepressants. He smokes two packs of cigarettes a day. He drinks a lot. And so one of the things he complains about, trouble falling asleep. He tosses and turns, moves his legs continuously. He grinds his teeth. He awakens at night to urinate. You could read what's going on with him. And so let me talk about all these different symptoms that he's having. You know, the trouble focusing, you know, people have heard of ADHD, and there are literally millions and millions of children that have ADHD. Whether or not it's diagnosed or not, they have it. And ADHD, it's not a learning disorder, even though this is what schools and doctors seem to think, that it's a learning disorder. No, the whole thing about ADHD, it's an interest disorder. In other words, if these children are interested, they will focus. If they're not interested, they will not focus. And the reason for that is that adrenaline is a neurotransmitter, makes the brain go very quickly. So if they're not interested in terms of you know, what they're looking at, they'll get distracted very easily. Now, he also had insomnia. He has what's called restless leg syndrome, depression, high blood pressure, alcoholism, anger, and overactive bladder because he had to urinate a lot. And bruxism is teeth grinding. Now, every one of these conditions is related to excess adrenaline. Now we're up to patient. Now this is another patient, and she plays the piano. She's an amateur artist, and what this is saying right away is that she's a creative type person. And why it's important to understand about creative type people is that these are the people that have the most adrenaline. Now, she keeps her teeth clenched, which is TMJ, and she awakens with low back pain and pain along the side of her hip. Classic symptoms of something called fibromyalgia. And there are somewhere between 4 and 10 million people in this country that have fibromyalgia, and every one of them have been told that there's no cure for it, and that's not true. One of the major symptoms of fibromyalgia is fatigue, and the reason for that is that people with fibromyalgia, they keep their muscle tense a lot. Now, she vomited throughout her entire pregnancy, and they call that hyperemesis gravidarum. And the only thing that causes that is excess adrenaline, and you only see that in creative type women. Now, she also complains about persistent pain in the bladder and a lot of burning when she urinates. And these are the classic symptoms of something called chronic interstitial cystitis, another condition felt to be incurable, and another condition that's caused by excess adrenaline. She has hot flashes at night. They actually were coming on around 2:30 in the morning, and that's when adrenaline peaks. And excess adrenaline is another cause for hot flashes. Now, you know, she falls asleep when other people are driving, and this is very symptomatic of people that are creative. Anyway, so she has severe PMS with mood swings, and rages. And those are the classic symptoms of something called PMDD, which is a premenstrual dysphoric disorder. It's a severe form of PMS. And there are anywhere from 4 to 8% of women that are menstruating that have this condition. Another condition felt to be incurable because they don't know what causes it. They don't know how to cure it. But again, it's caused by adrenaline and it's easy to fix. Now, let's talk about weight. You know, a lot of people complain about weight, and what the people don't realize is probably the number one reason why people have a weight problem is because of adrenaline. And the reason for this is that the reason why the body puts out adrenaline is to raise sugar levels for the brain. And remember I said that adrenaline peaks around 2:30 in the morning. And so people are lying in bed, not moving, and they're putting out a hormone that raises sugar levels. And the whole thing about sugar is that it doesn't matter whether you're eating sugar or if the body is making sugar. If you don't burn it up, all that extra sugar gets stored as fat in your fat cells. And it gets worse because when the body puts out adrenaline, it creates stress to the body. And the body responds to stress by putting out cortisol. And the first thing that cortisol does in order to deal with stress is to raise sugar levels to deal with the stress. So now while people are sleeping or trying to sleep, they're lying in bed, they're not moving, they're putting out 2 hormones that raise sugar. And this is unequivocally the number one reason why people are fighting weight all the time. And it's, again, unknown to the medical system. So just as a recap, she had a creative type ADHD. A creative type ADHD is what other people call ADD, attention deficit disorder. This is something that they named like children that have trouble focusing, but they're not hyperactive. But these are the creative type people. And again, fibromyalgia, chronic interstitial cystitis, hyperemesis gravidarum, PMDD, all these conditions felt to be incurable, by the way. So let me go over, you know, how does somebody know that they have excess adrenaline? Okay, well, first thing they might notice, they have trouble, you know, falling asleep or staying asleep. People that toss and turn, people that have what are called restless leg syndrome, people that grind their teeth, hot flashes at 2:30 in the morning, people that awaken with low back pain and hip pain, people that are quick to anger, you know, road rage, people that it can be night to urinate, people that are type A personalities, trouble focusing or brain fog. The thing about adrenaline, remember, it's a, you know, the fight or flight or hormone, and it's a survival hormone. And part of the survival response that adrenaline creates in the body is that it cuts off blood supply to certain areas of the body that are not needed for survival. And classically, this is the intestines, because they're not needed when people are in danger. So it cuts off blood supply and it causes constipation. And, you know, and it also, remember, we talked about weight gain, you know, the glucose and the, you know, both from adrenaline and cortisol. And also, it's the number one reason why people get involved in drugs and alcohol. They're just trying to relax. They're just trying to, you know, you know, chill out. People that have urgency during the day, in other words, when they have to urinate, when they have to go, that's adrenaline. And a lot of women, when they're running to the bathroom, they get some leakage, and that's called urgency incontinence. And again, this is all adrenaline. And, you know, on television, they advertise it as an overactive bladder. And, you know, and what they, you know, doctors are doing now is that they're injecting Botox into the bladders of these women to help with the urgency. The problem is, and what they're not telling these women, that for the next 3 months, they're going to have to, you know, catheterize themselves every time they have to urinate because of the Botox. Now, more symptoms, you know, when you see somebody sitting down and they're tapping their leg up and down, that's adrenaline. Again, cold hands and cold feet. Remember, adrenaline cuts off blood supply to certain areas. and this cutoff of circulation in the feet can lead to what's called diabetic neuropathy. People with a lot of adrenaline almost always carry tension in the back of the neck, and this can cause ringing in the ears, tinnitus. when they have blood tests, they may have what's called elevated hemoglobin A1C, and they're told that they're pre-diabetic, but they're not pre-diabetic. They just have a lot of adrenaline that's raising sugar levels. Bedwetting in children is only caused by excess adrenaline, and that's something that can be eliminated in 24 hours. But a lot of these children deal with it for years. There's a condition called occipital neuritis that nobody's ever heard of, but let me tell you something. Everybody that has occipital neuritis, they're always told that they have migraine headaches. And what's interesting is that migraine headaches are rare. Occipital neuritis is actually relatively common. And these are severe headaches, and very often, they arise from the occipital nerve sheath at the base of the skull, and the pain shoots right into the back of the eye. And like I say, it's always mistaken for migraines. But what's good about occipital neuritis, these are easy headaches to get rid of, and we'll talk about that. People that get cramps in their calves or their feet, that's again adrenaline. And let me tell you something. You may have heard of babies that have colic, and colic is also caused by excess adrenaline. And these are the babies that when they're in the womb, before they're born, these are the ones that do a lot of kicking, which is also adrenaline. So this whole problem with excess adrenaline can start right, right at childbirth. And this whole thing about colic in babies, sometimes, parents stay up all night with these crying children. However, there's a way of eliminating colic within 3 minutes, and we'll talk about that. And you talk. Oh, now you may have heard of a condition called adrenal fatigue. What's interesting, there are probably about 10 books written about adrenal fatigue. And it's actually a condition that doesn't exist. It's a naturopath diagnosis because they do saliva tests. And the problem with saliva tests for hormones is that adrenaline cuts off blood supply to the salivary glands because they're not needed for survival. So the hormones don't get into the saliva, but when they do a saliva test, they find a low cortisol level in the saliva. And based on that, they diagnose adrenal fatigue. However, if they did a blood test for cortisol, they would find that the cortisol level is actually high. So just want to let you know that. Okay, this is all about adrenal fatigue. So if people that like to have objective evidence that they're dealing with what they're dealing with. Again, an elevated blood cortisol done before 9 o'clock in the morning, anything higher than 13 should be considered high. Do not go by the normal levels. The normal level usually is 19.4, but again, they use medical students to determine a normal cortisol level. And so all doctors have increased adrenaline. Another thing, we talked about the elevated hemoglobin A1C, and this is also a common finding when people have excess adrenaline. Also, the other thing about adrenaline is that it's a stimulant. And when people have a lot of adrenaline, they don't tolerate thyroid because thyroid is also a stimulant. And when the body puts out cortisol, to deal, because of the stress caused by adrenaline, cortisol is an anti-thyroid hormone. So very commonly, when people have a lot of adrenaline, they also have a very low thyroid. Just want to let you know that. And it's important to understand this because if you're going to lower your adrenaline and your thyroid is on, is on the low side, well, that low energy is going to kick in after the adrenaline goes away. So just want to let you know that. So let's talk about treatment. And I hope I'm not going too fast because I know I'm throwing a lot of information at you people, but so in order to treat excess adrenaline, you have to treat the reason why there's increased adrenaline. So for example, remember we talked about there might be too much insulin, which lowers sugar levels, then the body puts out adrenaline to raise the sugar level, or they're not eating correctly. So that's where something called Progesterone Cream comes in, and which I had to tell you is my favorite hormone. And the thing about Progesterone Cream, it blocks insulin, and it also blocks adrenaline. So it actually blocked the two major causes of excess adrenaline. Now, the only other thing that you have to do other than progesterone cream in order to correct this is to provide the right fuel to the brain. And and remember, the brain uses two different fuels. One is glucose, and the best source of glucose for the brain actually comes from vegetables. And get the brain of vegetables, and green vegetables are essentially zero glycemic, which means that they do not stimulate the release of insulin. And the other source of fuel for the brain are ketones. And so glucose comes from the vegetables, and ketones comes from either coconut oil or something called MCT oil, medium chain triglyceride oil. And keep in mind that the brain can actually use up fuel in about 3 hours. So these are the kind of fuels that, if somebody has a problem with excess adrenaline, should be provided throughout the day. Now, I want to talk about creative type people, because remember, these are the ones that have the most adrenaline. And people who are creative, these are the people that are very intuitive about other people. In other words, they can pick up good energy or bad energy from people. And they have premonitions, and they have deja vu type feelings. And they find that animals are very attracted to them. So I just want to let you know that. Here, now progesterone cream, it comes in different strengths. And, but what we're talking about is a 5% progesterone cream, and 5% means each pump provides 50 milligrams of progesterone, and that's the exact strength you need to block adrenaline. It's also the most effective strength for blocking estrogen, which is very important, and it also is a great strength for blocking insulin. So again, a lot of, I'm going to go over some of the benefits of progesterone. It blocks estrogen, and, estrogen causes cramps and breast tenderness and AM morning sickness and endometriosis, polycystic, all these different conditions. Also asthma, gallbladder disease, cellulite, bad around the hips, thighs, and buttocks. It causes 6 different cancers in women, and it causes prostate cancer in men. And progesterone can prevent or help with all of these problems. And then and what it does, it actually blocks estrogen receptor sites. These are some other benefits. I can't go over everything because I know you, but now these are 2 progesterone creams that I recommend because I've had them manufactured exclusively to block adrenaline. The difference between, they're both 5% progesterone creams. This one has oil of lavender and this one doesn't. Otherwise, they're exactly the same. They're available on my website, and we'll go over that in a second. This is a book that I've written called Adrenaline Dominance. This is the cover. This is the back of the book. But it talks about all the different conditions related to adrenaline. This is the only book that's ever been written that talks about the clinical consequences of too much adrenaline. This is why it's unknown to the medical community. And this book got 5 literary awards, by the way. Okay. Now, this was my first book called The Miracle of Bioidentical Hormones. And this book literally brought thousands of patients to my office from all over the country and all over the world came in because of this book. But I have to tell you, the experts for the medical board in California felt the ideas in this book were so dangerous, I shouldn't be practicing medicine. And the reason for that is that the book talks about treating the cause of illness and using hormones to get people back in balance to eliminate all these problems. And the problem with the medical boards is that they're there to protect the business of medicine. And they get they're 100% funded by drug companies. So this is an anti-drug book. so that's why they didn't like it. This is a manual that I wrote for doctors, and this is more about the manual. I'm sorry, I didn't realize this was on there. So I think, anyway, I probably create, can you hear me? I don't know if I can hear.
Yes, we can hear you, Dr. Platt. We can
Yeah,
hear you.
I don't know if your people have any questions, I'd be glad to answer. And I hope, because I know that a lot of it was sort of new to people.
No, I think that we've had actually two hormone programs on, but what we will do is ask people to raise their hands. You may not be able to see that raised hand, and you won't unmute until your hand is called, please, because someone just now was making a lot of noise. So we don't want the noise, but we can ask questions. Dr. Platt, when you talk about the early development in young girls that's happening now, is that food related or is it drug related? So are you able to answer that?
Are you talking about like early breast development?
Yes, because it's hormonal
It is
that they're
hormonal.
starting.
The problem is that estrogen, the body does release estrogen, but unfortunately we live in a world where people get exposed to estrogen all the time. It's found in different foods. They fatten, chicken with estrogen, so it's hard to avoid, soy is estrogen. So I have a feeling it's mostly from what they're eating that they're maybe developing early.
Okay, and also, what about the pesticides that are being sprayed on our vegetables? Is that associated with hormonal imbalances?
I haven't heard that they're associated with hormonal imbalances. They're certainly associated with cancer, which isn't good either.
Okay.
Yeah, but I don't know if they affect our hormones.
Okay, we're going to go ahead and have FS ask a question, please.
Yes, good evening. For a person who has taken out their womb and is having hot flashes or stuff like that, what can they actually do?
Well, I
don't know if that have anything to do with the adrenaline.
Oh, does what have anything to do with adrenaline? I'm sorry, I have.
Hysterectomy.
Oh, hysterectomy. Oh, just about every hysterectomy occurs because of problems related to estrogen. Fibroids and endometriosis, excessive bleeding. It's all caused by estrogen. And what's nice about progesterone is that it blocks estrogen.
Okay.
And it could help prevent a lot of these conditions. But I have to be honest with you, doctors, including gynecologists, do not know a whole lot about hormones. I have to tell you this.
One more question, but is the estrogen otherwise unnecessary for us?
Is estrogen? Is it? I'm sorry.
Yes. Is it still important for us to have? I'm not sure how this works.
Yeah, I had to be honest with you. I'm not a big fan of estrogen. To me, I consider it a very toxic hormone. The only reason a woman needs a high level of estrogen is if she's trying to get pregnant. A lot of women who have had hysterectomies, by the way, because they don't have a uterus, doctors say they don't need progesterone, and that's absolutely wrong. Progesterone is absolutely the most important hormone for a woman to replace, and it's an exceptionally important hormone for men. And most doctors think that progesterone is a hormone, and it's not. Men and women have the identical hormones. And, if men had enough progesterone, there'd be no prostate cancer. And also it's the hormone that controls insulin, but men stop making progesterone around the age of 50. And but when it comes to estrogen, if women have fat cells in the body, they're always producing estrogen. But when it comes to estrogen, there is one estrogen that I do recommend, and that estrogen is called estriol. And estriol is one of the 3 natural estrogens, but it's the only one that doesn't cause cancer. And it's the only one that's effective for vaginal dryness. People need to know that.
And what is the source of the estriol?
Well, they can get a therapeutic strength on my website. Along with the Progesterone Cream on my website, which is.
But yours is also sourced from like wild yam. So
right. We have no soy-based hormones.
okay, alrighty. And so you mentioned that it's for men as well. So you found that there are high imbalances in the men.
Okay, most men have problems related to excess adrenaline.
Okay.
That's where anger comes from, road rage comes from. And you can get rid of road rage in actually 24 hours. You can get rid of ADHD in 24 hours. You get rid of fibromyalgia in 3 days. I mentioned before that colic in babies, you can get rid of colic in babies in 3 minutes just by rubbing progesterone cream on their belly. And it's an incredibly safe hormone to give to children. When a fetus is in the womb, it gets exposed to incredibly high levels of progesterone. So it's a very safe hormone to give to anybody, which is nice.
Well, I love the fact that you say it's good for babies. So parents are actually experiencing a lot of imbalances as well with their children. How does this address what children, what parents are going through?
Well, colic in babies, that's one thing. And then you have something called the terrible twos,
Yes.
that's also caused by excess adrenaline. And what I mentioned before, bedwetting in children is only caused by excess adrenaline, and then you can get rid of it in 24 hours just by lowering adrenaline levels. It's not hard. It's not hard to get people well. You just have to treat the reason why they're not well. And doctors are not trained to treat the cause of illness. I can't emphasize that enough. People, if they really want to be healthy, it's really important for them to become proactive. They have to learn themselves how to get better. They can't rely on a medical system that has no interest in actually getting them healthy, believe it or not.
That's very transparent of you. I like that you're saying that. I mean, you as a medical doctor, I am pleased that you are able to have made this type of discovery. But what about in autistic children?
Well,
how does this help?
Well, autistic children have incredibly high levels of adrenaline, and they are helped immensely by lowering their adrenaline levels. Children that are autistic, that don't communicate, that don't talk, as soon as you lower their adrenaline, they'll start talking. And like I said, you can lower it in 24 hours just by providing them with the right food, vegetables and coconut oil and MCT oil, and using progesterone cream. And they respond wonderfully. Now, remember, these are extremely intelligent children. Adrenaline as a neurotransmitter is what gives people intelligence. And, that's why some of these kids, they can memorize a phone book. It's just that they have so much adrenaline that any little stimulus is too much for them. That's why they avoid contact. But once you lower adrenaline, boy, they start talking and, they start communicating. So,
well, I'm too sad that you don't know the source though because like my mom is born in another country, and I'm noticing that the issues that women had in this country, they didn't have in her country years ago. So there has to be a food source that is causing or creating these imbalances. Although they develop them probably after they've been in America for a while. So so you don't have any food sources that would be creating this.
Well, you talk about food sources that are causing this or food sources that'll help with this?
Causing.
Well, we have a lot of refined foods that are high in sugar.
Mm-hmm.
problem with sugar is that it stimulates a lot of insulin, and insulin lowers sugar levels in the body, and that causes the release of adrenaline. You know, that's why kids with ADHD, if they eat candy or drink soda, they become even much more hyperactive because the body's putting out even more adrenaline. But that's where, like green vegetables, they don't produce any insulin at all. And so they're the best source of glucose, sugar for the brain. A great side dish are sweet potatoes that have been sliced up and fried in coconut oil. A perfect breakfast would be scrambled eggs cooked in coconut oil and put on a bed of spinach.
Well, yes,
you know,
I know we promote plant-based though, so eggs would not be something that we promoted, but I understand where you're coming from as far as trying to get that protein level up high in the morning. So would beans suffice for that?
Well, it's not the reason I said scrambled eggs, but cooked in coconut oil. So I was really promoting the coconut oil rather than the egg.
Okay.
It's just another way of getting, you know, ketones and glucose into the meal.
Okay.
That's all.
And so you also said MCT oil. We have been seeing the benefits even here with the MCT oil.
Okay.
How is that important for people with like certain stages of dementia, or, you know, but is that just adrenaline associated, or is it, you know, something in our diets, or
Well,
what's the cause?
you know, I mentioned before about coconut oil helping to cure Alzheimer's, but MCT oil would actually be even better. MCT oil comes from coconut oil. The difference is it has no flavor like coconut oil does. And it's not as good as a cooking oil like coconut oil, but they're both good. They're both wonderful for the brain. Coconut oil and MCT oil, great for the brain.
Okay, so people are asking questions in the chat. I would hope that they would just raise their hands because I can't see all the chat questions. If you raise your hands, you can ask Dr. Platt your questions yourselves. We just need to do it a little orderly. So, Sister Candace, are you seeing any questions that I'm missing in the chat room?
I see some questions in the chat, some things that it seems like they've been answered already. What about a 7-year-old child that has symptoms of ADHD? And someone said, I think you answered that. How do you get rid of ADHD and other challenges in a short time frame?
Did you say a 7-year-old with ADHD? Is that what
Yes, a
Okay.
7-year-old ADHD.
Again, ADHD, let me start off by saying that the most intelligent, successful, creative people in the world have ADHD. In fact, the most successful have 2 different types of ADHD. By 2 different types, I'm talking about ADHD and ADD. Okay. And remember what I said, it's not a learning disorder, it's an interest disorder. If he's interested, he'll focus. If he's not interested, he will not focus. However, but it's all caused by excess adrenaline, and just by providing the right fuel, which is the glucose from vegetables and ketones from coconut and MCT oil, and using progesterone cream, in 24 hours, his ADHD should be gone. I'm telling you that. So, and now keep in mind also that if your child has ADHD, he got it from one or both of his parents, because it always runs in families, 100% of the time. So I just want to let you know that.
Okay. So when you're talking about ADHD, and you're saying that parents can heal this in just 24 hours, where are they applying it?
What? I'm sorry, what is what?
Where are they actually applying the cream? How do they use it? Would it be like 3 times a day, or, how? Yeah.
What's nice about progesterone, they can't overdose on it. So usually what I recommend, you start it at about 3 or 4 times a day. And then once all the symptoms go down, then cut it down to maybe twice a day. The best place to apply the progesterone cream is on the forearm, and you rub the 2 forearms together. But a lot of people that have excess adrenaline, they carry a lot of tension in the back of their neck. And so the back of the neck is an awfully good place to put progestin cream as well. And that will get rid of the ringing in the ears. It'll get rid of headaches and stuff like that. So.
And so have you found this prominent also in like elderly?
It's good for people of any age. You know, excess adrenaline doesn't go away. So,
Okay. And so
yeah.
why do we need to absorb it through the skin level?
Well, that's an excellent question. When you put it on the skin, it goes directly into the bloodstream.
Okay.
When you take progesterone orally, and they, you know, most doctors are now prescribing oral progesterone, it goes straight to the liver and converts into a different hormone called allopregnanolone, which is not progesterone. So the only way, there are only two ways of actually getting progesterone, real progesterone, either on the skin or used or through the mucous membrane, you know, intravaginally, but, you know, like suppositories. But for most people, the cream is the best. So.
And so why, I've never even heard of that, suppositories. Why would someone use a suppository?
And, you know, women that have endometriosis, women
Okay.
with severe fibroids, they have no other, you know, that, you know, but, you know, progesterone.
So this is a great, now, I can't let you go forward, because with fibroids, you're saying if you use suppositories, that this would actually shrink them faster?
It'll get rid of endometriosis. It'll get rid of polycystic ovaries. It'll get rid of fibroids.
But through a suppository.
Right. But you can also get a lot of benefit just from the cream when they have fibroids and endometriosis. And, you know, you have to remember, doctors know nothing about hormones and very little.
I appreciate you, Dr. Platt. Okay, go ahead and unmute Miss Pauline, I believe, is next. Pauline, go ahead and
Yes.
unmute your phone. Go ahead.
Good evening. Yes, I was asking if the MCT powder has the same effect as the MCT oil.
Probably, yes. Anything with MCT would probably raise ketone level. You know, so the powder would be just as good as the oil. Yes, absolutely.
Thank you.
Am I allowed to mention my website in case people want to get
You
some?
sure can. And we do have 2 health food stores on here that we would love for you to actually get the product to. So we're going to have to speak to you about that later.
Okay. Yeah, we sell to health food stores all over the country. So.
Okay. All righties. Galaxy A11, go ahead and unmute, please.
Can you hear me?
We can.
Okay, so I have 2 things. My
Well,
first question.
we do one question at a time. Okay.
Okay, well, my dad has prostate cancer, and so
Okay.
how does that affect? How does hormones play in that? Because they're wanting to lower his testosterone levels to help with the prostate cancer. Is there anything that he can take that you have on your website to help him avoid taking those shots?
Yes. You know, testosterone is not the cause of prostate cancer, but testosterone can convert very easily into what's called estradiol, which is the strongest type of estrogen, and that is what causes prostate cancer. So when it comes to testosterone, they don't really have to lower it. They just have to prevent it from converting into estrogen. And that can be done in a number of ways by using what are called aromatase inhibitors. Something as simple as zinc, you know, which is, you know, it's good right now for, you know, for the flu and for COVID-19. Zinc is good for that. But zinc also is an aromatase inhibitor. The progesterone is also an aromatase.
Dr. Platt, I'm sorry to break in. Can you please tell us that in layman terms? I know you're gone. Yes.
I'm sorry. Aromatase is an enzyme that converts testosterone into estrogen.
Okay.
So, okay. So, you know, but the other thing, that there are certain supplements that people can get to lower estrogen, things like, and any health food store will have this, like which is diindole mutase, and I3C, which is indole 3-carbinol. So in other words, and just to give you an idea, in Europe, they actually treat prostate cancer with testosterone. So, so this whole thing about lowering testosterone, testosterone is not the issue, it's the estrogen that they have to be concerned about. And that's where progesterone comes in, because, it blocks estrogen from causing cancer. So, and
so is that true? Is this why we have like a lot of men now with sort of like female tendencies? Or
well,
I wouldn't say, would female tendencies be the political correct, or like, in other words, they're growing their ass. You could see them, they speak with higher tones, tone of voice,
well, after the age of 50, women go into the menopause around the age of 50, men go into what's called the andropause around the age of 50. And when men go into the andropause, what happens is that testosterone levels go down and their estrogen levels go up. In fact, men have a higher level of estrogen as they get older than women do. And so, estrogen is not a happy hormone. And, like I say, it's my least favorite hormone. So when it comes to prostate cancer, just so your listeners would know, I never, ever, under any circumstances, recommend a biopsy of the prostate.
Oh, no.
Wow. And why would you not recommend that?
Well, most men, if they live long enough, will have prostate cancer.
Wow, with having a biopsy.
But what happens is, but only 7% of prostate cancer spread outside the prostate. So most men die with prostate cancer rather than from it. But once you start putting needles into the prostate, and when they do a biopsy, they do anywhere from 12 to 24 biopsy sticks, and that allows the cancer to get into the bloodstream. And I suspect that's how prostate cancer spreads, is by the biopsy. So I never, ever recommend biopsies to men for the prostate.
Wow, excellent. Very transparent. Okay, go ahead with one question, Miss FS, go right ahead.
Okay, pertaining to the food, this child with the autism, you mentioned the sweet potato, the coconut oil. You had suggested no refined, so like yam and those stuff are okay.
So she's talking about ground foods, Dr. Platt.
Talking about what? I'm sorry?
Foods that grow under the earth. So like yam, sweet potato.
Right.
Different countries have different ones. There's yellow yam, Would you?
Okay, and so the question is vegetables that are growing underground, is that what the question is?
Yes. FS, you're making a lot of background noise and we're gonna have to mute you, please.
Okay.
All right, go ahead.
Yeah,
I'm sorry, you can go ahead and answer the question.
Yeah, I have to apologize. I don't understand what the question was related.
Okay, so in certain islands, they have foods that they call provision. And so that provision would be like starchy, high starch vegetables. They look like potatoes, but they're not. Okay. So can she eat that? She's asking. I think that was her question.
Well,
it has high estrogen.
Well, they have, starchy type foods are usually high in sugar.
Right.
But they have what are called resistant starches, which are actually good sources. For example, cold potatoes become resistant starches. So potato salad would be okay.
Wow.
White potatoes are high in sugar. But you are allowed to have sweet potatoes, not yams, but sweet potatoes. And, because they, like I say, slice them up and fry them in coconut oil. And that's a really good side dish to provide fuel for the brain.
Okay.
But I know I didn't answer her question.
It's okay. You may not be well aware of those. Someone asks, if a 47-year-old is having difficulty getting air in after falling asleep in the middle of the night, no asthma, a week before starting her menstrual cycle, and a few times during cycle, then issue goes away. Is that hormonal too? What can help?
Well, right, as her cycle is approaching, her progesterone level has gone down. And so that means that her adrenaline level has gone up. So, but if she was to start using progesterone cream, then she would sleep throughout the whole night. We wouldn't have that problem.
Wow. Beautiful. I love it. Okay, so someone's asking, where do you place the cream for the prostate issue?
Oh, well, the arm is fine.
The arm is still fine? It'll absorb and get to that area?
Yeah, it goes right into the bloodstream. Yeah, there are hundreds of receptor sites throughout the body, but it'll go where it needs to go.
And so you said the forearm before. I know you did say that.
Yeah.
Okay. And so someone was asking, is this good for autistic kids?
Autistic, yes. It's excellent for autistic children.
Okay.
Yeah.
All right. And so I can't get all the questions. I wish that people would raise their hands. Okay, go ahead, Lynn.
Yes, I had an experience with progesterone, which caused acne. And what do you think was the reason for that? And also, I understand the MCT benefit, but I promote the whole food version in the actual coconut as opposed to the oil. What would you say about that?
Okay, can you, before he answers, can you list the brand of progesterone that you were taking?
Oh, I don't remember.
You don't remember. Okay, and that might be why you had the issue. You need a pure wild yam version, but go ahead, Dr. Platt, and answer the question.
Well, progesterone theoretically can downregulate into testosterone. It's unusual that it does that, but it can happen. Usually it's not a problem. And in fact, progesterone can sometimes eliminate acne. So I don't know, I don't know what happened there. And the other question was about the MCT oil.
Yeah, should she get it straight from the coconut?
Well, no, it has to be converted. Yeah, you have to get the MCT oil separately.
Okay. All right.
Yeah, I don't know how they convert it, but but we can't do it.
Okay, Candace and Fred, can you guys help me out a little bit with some questions here in the chat, if you can see them? Let's go ahead, Ruth Dwyer. Ruth Dwyer, and unmute.
Hi, the progesterone cream, you're saying that you should rub the forearms. I've heard that in using those creams, every time you use it, you should use it in a different place on your body. What do you think about that?
I don't think much about that. The best place is on the forearm. What I do recommend, and I'm glad that you brought this up, is that every once in a while, take a loofah sponge or some kind of exfoliating sponge and scrub your forearm. And what that does, it gets the progesterone cream out of the pores. You don't have to worry about the receptor sites. They're not going to get overloaded.
Wow.
So
thank you so much for sharing that, because we have been told that the progesterone should only be used at in other words, we could not absorb more than a quarter size, was what I heard from one health professional. And then that we should watch the amounts that we were trying to put in, but you're saying 3 to 4 times is okay.
Right, you can, like I say, you can't overdose on it. You can run out of it, but you can't overdose on it. But places like the abdomen and the inner thighs, they have a lot of fat cells, and you don't want to put progesterone over fatty tissue, because you want it in the bloodstream, and that's why the forearm is the best place to get it absorbed into the bloodstream.
And why not on fatty tissue? Because I know that some women products, they promote it for like your skin, like your face. So why would you not put it on fatty tissue?
Because it goes directly into the fat cells. And you know, the thing about progesterone, it's a thermogenic hormone. It actually helps fat to burn, but but only if it through through the bloodstream. You know,
Right.
estrogen.
So you've had thousands of patients, right, Dr. Platt? Because someone is saying that the accuracy of where to place it may be a little iffy. So, but you've had a lot of people actually doing it, and so
Yeah, and the back, and like I say, the back of the neck is a good place also.
Okay.
You know, if you think about where people blush, that means they have a good blood supply. Like the upper chest would be another place because the people get red there. The back of the neck, people get red, and the cheeks. So any place where there's a good circulation is the place where you should put progesterone cream.
Okay. NX, go ahead and unmute, please.
Yes, good night, everyone. So my question is, I don't know if it's in line to what you're talking about, but what would be the possible cause for a teen to stop seeing her period, and what could she possibly use to assist? That's one question. And the other one is a quick one too. What would you recommend for a severe allergy to nut seeds in children?
Okay. I think I missed both of the question.
Well, someone has an imbalance where they're missing their period, so we'll go with that one.
Well, you know, progesterone is the best hormone for regulating periods.
Okay.
And the so I would start with just using progesterone to see if they can normalize. And the second question, did you get that one?
No, I didn't, but we can go right ahead to Georgiani. Ania.
Can I
Well,
ask?
I'm sorry, sis. Hold on, sis. We have one question at a time on here. So let's go ahead, Miss Georgiana.
Hello, good evening, everyone. And actually, Georgiana and Oneida here. Oneida is asking the question. And actually, it's more on how to use the cream. I've used it in the past, so I would kind of like to hear mention if it's 3 weeks, then take 1 week a break, etc. When you start the cream, if you're menstruating still, when should you start it? When should you stop with that month period? Thank you.
Okay, Georgiana, I have to be honest with you. I don't usually recommend cycling it. I usually have women use it every day. And the reason,
Wow.
well, the reason for that, if the only issue was problems related to estrogen, then there could be a rationalization for cycling, but not a big one. But most of the people I deal with have excess adrenaline and problems with insulin, and those hormones are released every day. So I have people use progesterone every day to help with the adrenaline and insulin.
Wow. So then our understanding of adrenaline and how it works is really off. So Dr. Platt, can you tell us why the adrenaline is over on so many individuals? Why are we?
I mean,
why
is it an issue with so many people?
Yeah.
Well, I think a big part of it has to be, remember I said that the body uses adrenaline to provide fuel for the brain. And the fact is that a lot of people don't provide the right fuel to the brain. And so the body relies on adrenaline to do it. You know, people, you know, for example, athletes, their muscle burn up glucose all the time. So they're living on adrenaline, and you have people that are in the military and law enforcement, and these people all have excess adrenaline, you know, and but it's mostly genetic. In other words, if your parents had high levels of adrenaline, then you're going to have high, you know, the children will have high levels. And it's important to remember what I said about creative type people. And there's a lot of creative people, you know, people in the in music industry and people in television and movies and people that, you know, like interior design and you know, there's so many creative type industries. And these are the people that had the most adrenaline. And nobody ever talks about that. And because these are the people that use their brain a lot. And remember, the brain, you know, uses up most of the sugar in the body. And so I'm just saying it's a genetic thing. I don't know why. I think it's always been with us. But I think in the old days, we ate better than we're eating now. And
Yes. Yeah. It's very true. Okay, let's go ahead to 845, please. You can unmute, ask your question, one question at a time, please.
Hi, yes. Good evening, everyone. My name is Hannah. I'm just asking about the progesterone. Have you found in the people that you treat with progesterone that they have to take it for life, or are there other things they can do to eventually get off of it and be
Excellent.
normal?
You know, I tell people that when they go on progesterone, that later on, as they're being lowered into the ground, that they take some progesterone with them, which is another way of saying that it is.
Yes.
It has so many healthy benefits. You know, it blocks adrenaline, insulin, and estrogen, which are the three most toxic hormones in the body. So,
Thank you.
yeah.
And so have you seen, for those with fibroids, have you seen that they have gone away with just the daily use of this progesterone?
Absolutely, yes.
Wow, okay. All right, go ahead, Lewis, and unmute.
Hi, everyone. Okay, so we started using these creams recently, and for both my husband and I, and so I'd like you to explain, Dr. Platt, why my husband was given the S-less and also the progesterone cream to use.
Okay, well, S-less, you're getting from my website.
Yes.
Yes. Okay. S-less is a combination of indole-3-carbinol and diindole mutase. That's used. Does he have a prostate issue? Is that?
Yes, enlarged.
Yeah. So it's to help his prostate is why the S-less, and the progesterone will also help because, like I say, it's an aromatase inhibitor, and so it blocks estrogen from going to the prostate. So if you're ordering it for him, then you must like him. So.
Alrighty.
Okay, I just wanted you to explain that in case someone else is wondering, you know, about the enlarged prostate, you know, because, you know, with women and, you know, it's like, oh, they have too much estrogen, they have too much, or, you know, so it kind of, sometimes it doesn't make sense that we both would be taking the same hormone.
Well, it's not a woman's hormone. Remember, men and women have the same hormone. And you know, after the age of 50, men stop making progesterone. But I'm sure he's also on something called natural prostate for his prostate and lycopene. I mean, there's all sorts of things that are good for the prostate. Zinc. Anyway, so you know, so there are a lot of things that can benefit the prostate.
Thank you.
Sister Ro, would you like me to read a question from the chat?
Yes, thank you so much.
Someone was concerned that children nowadays are depressed and aren't sleeping. What are your suggestions, Dr. Platt?
I'm sorry, I missed the question. What somebody is?
Children are now depressed and aren't sleeping, and they wanted to know what your opinion was on the matter.
Do you talk about children and sleeping? Is that what you?
Yes, children who aren't sleeping because of depression.
Well, again, the number one reason why people have trouble sleeping, including children, is adrenaline. Remember that, you know, it can cause bedwetting in children also, but remember, progesterone is very safe for children, but you can also give them, you know, vegetables and coconut oil and MCT oil. it doesn't matter what the problem is. People should always approach the problem from the reason why there's a problem. And like I say, when it comes to sleeping, the number one reason, for sleeping issues is excess adrenaline at any age. I don't know if I answered your question. But,
Yeah, that's perfect. Go ahead, Candace, one more question, and then I'll take 2 from the chat, and then we'll go ahead and do the raise hands.
Does vaccines have anything to do with high or low hormonal issues, or its effects in a child's estrogen levels?
it sounded like, did you say vaccine?
Yes.
Mhm.
You're talking about children's vaccines. Is that what you're talking about?
I think that's what they were referencing. Yeah, children vaccines.
The immunizations that we get here.
Yeah, well, it's a whole different issue. I'm not crazy about vaccines to begin with, but I think other than measles, mumps, rubella and DPT, that's fine. I don't know why they give children all these huge amounts of vaccines for hepatitis and all this kind of stuff. And I've never seen hepatitis in a child. But anyway, so I don't know. I don't think that they're related to hormones. I think there are other issues, but not hormones.
Okay, so we're going to go ahead and do Yvonne, and then we'll do Kimberly.
Oh, thank you so much. My question is, I was raised on coconut oil, mainly home-prepared, home-grown coconut oil. But now, as I'm older, I'm hearing negative things about coconut oil. What form of coconut oil is better for us to use?
I think anything I think any form of coconut oil is okay. I know, some are, they're called organic and whatever, but I think they're all pretty healthy. I think any kind of coconut oil is fine, I think.
Okay, and what about hair loss, Dr. Platt? Because this is a big issue. Is that hormonal too?
Well, hormones are big, yeah, it could be hormonal. Again, when it comes to hair loss, you have to treat the reason. Sometimes it's genetic, and there's nothing you can do about that. But a low thyroid is a very common reason for a hair loss, and people with low thyroid, they might find that the back of their heels, that the skin cracks, and that's a classic sign of an underactive thyroid. Poor nails, low body temperature.
For low thyroid, what would you recommend?
Well, if the thyroid levels are low, they would need to go on thyroid. It's tough out there, unfortunately, doctors treat lab tests, but very often they don't know how to interpret lab tests.
Okay. And so what about foot fungus? Is that hormonal related or no?
What is that called?
Foot fungus?
Oh, foot fungus, that's not, no, that probably is not hormonal.
Okay. All righty. Go right ahead, Kimberly, and unmute. Okay, she's not unmuted.
Yes, Dr. Platt, thank you so much for being on today. And my question is regarding brain health. I know that you spoke a lot about ADHD, and a little on, was it Alzheimer's? But when you're dealing with Parkinson's or dementia or just memory loss, what would you recommend directly to deal with that? And do you think exercise plays a role in boosting up the brain health?
Okay, well, I'm not sure exactly what you're talking about, dementia. And
so when you're talking about brain health and memory loss, whether it's Parkinson's, dementia, Alzheimer's, I'm kind of categorizing them under one umbrella because they're different
No,
degrees?
yeah.
Okay.
Well, any kind of neurodegenerative type illness affecting the brain can benefit from, again, from coconut oil or MCT oil. Great for the brain. But, you know, they have a lot of supplements for brain health. I'm not, you know, and I'm not convinced that exactly which ones are the best because it's hard to say. I mean, you know, whether it be fish oil, you know, DHA or huperazine, or, I mean, there are so many supplements that are good for brain health. It's a matter of, you know, just experimenting, find out which one seems to help. I wish I could be more specific. I can't. But when it comes to brain health, you know, progesterone, you know, most progesterone winds up in the brain. And, you know, it can certainly eliminate problems related to anxiety. It can help with depression. That's because a lot of depression is caused by internalized anger. So I would, you know, progesterone, I think, is very good for the brain also. It certainly is what gives us intelligence. So anyway.
Okay, go ahead, Candace, with the chat room questions.
Someone just asked what can be done for ovarian cysts.
It's good for any kind of problems. You're talking about like polycystic ovaries, or, but you know, but any kind of ovarian cyst caused by estrogen. So anything caused by estrogen can be benefited by progesterone.
Someone wanted you to repeat the information you provided about treating thyroid issues.
You know, if it's helpful, you know, you know, the book I wrote called The Miracle of Bioidentical Hormones talks a lot about thyroid. I'm not pushing, I'm just saying that, but you know, there are two different thyroid hormones, you know, T3 and T4. And, you know, but a lot of doctors, all they do is order a TSH test, which is thyroid stimulating hormone. But people have to realize that the only time that the pituitary puts out thyroid stimulating hormone is when it thinks you need thyroid. So there's no such thing as a normal TSH level. And yet they have levels that can go up to 4, and doctors consider that normal, and they're not. It's, like I say, it's tough out there trying to get things squared away. That's why people sometimes have to learn you know, things on their own and teach their doctors, frankly.
Okay, and so someone's asking Dr. Platt if they receive a discount from today for the to order.
Actually, if they go to my website, there's a sale going on.
Okay.
A great discount going on.
Okay.
I don't know if they know my website, but
let's go ahead and unmute Galaxy A10E. And then Georgiana.
Yes, hello. I had a question about the cream. I wanted to know if the cream, would it be helpful for Epstein-Barr?
Would it be helpful for
Epstein-Barr syndrome?
You're talking about mononucleosis?
No. Yes.
You know, first of all, just about everybody's been exposed to Epstein-Barr, and but the the direct answer is that the cream will not help Epstein-Barr. You know, a high dose of vitamin D might, because vitamin D is very good for viral illnesses. But you know, like I say, most people have been exposed to Epstein-Barr.
Can you explain a little bit about what Epstein-Barr is? Because it is sort of like a bacteria or something, right?
Well, it's a virus.
It's a virus, okay.
The other name for it is infectious mono or infectious mononucleosis.
And they never get rid of it?
Well, once you've been exposed to these things, you'll always test positive for it.
Okay.
So probably just about everybody will test positive for it. But I think that they may be blaming this for symptoms that people are having that are caused by a different problem. In other words, Epstein-Barr very rarely becomes a chronic condition. It just runs its course for a few weeks and goes away.
Okay. So, Georgiana, we're going to allow you to ask your question, but Brother Fred, we want to also allow the people on the phone line to be able to ask their questions. So go ahead, unmute Georgiana. If Brother Fred, you can help with the people on the phone line.
Oh, hi. I was asking this question. Does a change in the adrenal issue leads to seizures?
Interesting question. I don't know how to explain it or approach that, but you know, sometimes a low blood sugar can cause seizures. And you know, and that could be from, you know, too much insulin, which is a pancreatic problem rather than a, but I think if you're looking for one answer to your question, I'd say probably not. But I think that, you know, certain seizures can be benefited by progesterone because, like I said, it helps to control insulin. So again, I don't know if I answered your question, but are you talking about seizures in children? You know,
not necessarily. In adult.
Yeah, if they have a normal EEG,
yes,
then it's probably related to a low blood sugar. And then yes,
okay.
then I say here the progesterone would help, but it's not like an adrenal issue. But I think it might be related to the fact that the brain is using up too much sugar.
Okay. Next question. What's your website?
Sis, you know what? She just jumped right in there and did that. So we're going to allow you, Miss Georgiana, if you write it in the chat, we'll allow someone else. Go ahead. We're going to, his website is in the chat room. Go ahead, Brother Fred, and let's unmute the people on the phone.
I'm speaking and I don't have my microphone turned on.
Oh,
If there's anyone
okay.
on the phone right now that would love to unmute themselves, just go ahead and unmute yourselves now. And I will pick whoever unmutes themselves if you have a question. And I do see that we have about 5 callers out there that are on the phone. Anyone on the phone would love to unmute themselves, ask a question? All right, I do see iPhone. Go for it.
Hello, this is Adrian. Can you tell me the website because I'm not in the chat room? Hello?
Oh, you want me to say?
We can hear you. What's the website?
Hi.
It's
Yeah.
it's www.plattwellness, PLATT-wellness.com, plattwellness.com.
www.plantwellness.com. All right, thank you. All right, I see Renee. I see you have your hand unmuted. Go right ahead.
Yes. Could you share more information about ways to improve our memory as we age?
Okay. You know, it's a normal thing that happens that memory is not as sharp, but there are ways of like maintaining a better memory. And like I say, there are a lot of supplements. If you go to any health food store and ask them for things that aid the memory, you'll be able to get that. But you know, fish oil is good for the brain. We have something on my website called for the memory. But anyway, yeah. So
yeah. So
yeah.
Yes. So, well, did you actually answer the question for the brain or no? Did you answer?
Well, one thing that people should be aware of, there are certain drugs that greatly impair the memory. You may have heard of, things like statin drugs. Statin drugs destroy the brain. They cause symptoms very similar to Alzheimer's. Statin drugs, they cause brain damage and memory loss. They cause irreversible kidney failure. They cause permanent nerve damage. They cause heart damage and sudden death. I mean, and these are the #1 selling drugs in the world. So again, if you're having memory issues, make sure it's not a drug that's causing them. That's all.
Wow, thank you so much again for your honesty. So if you did not hear that, he did mention statins as being a major cause for some illnesses. Okay, someone asked, they needed more information about adrenal insufficiency, what can be done to correct it. They'd want natural remedies.
Okay, if they're talking about, there's a difference between adrenal insufficiency and adrenal fatigue. As I mentioned before, adrenal fatigue is a non-existent condition. It's a naturopath diagnosis because they do saliva test. And when people have increased adrenaline, you cannot do a saliva test because the adrenaline cuts off the blood supply to the salivary gland. Adrenal insufficiency is where the adrenal gland just doesn't produce enough adrenal hormones. And that's a condition that has to be treated with hormones, with adrenal hormones. But I have a suspicion they were talking more about adrenal fatigue. People that have a lot of adrenaline, it causes the muscle to tense up, and when you keep muscle tense, uses up a tremendous amount of energy. So these people will complain about fatigue. But the fatigue is caused by excess adrenaline. So adrenal fatigue is really adrenaline dominance rather than adrenal fatigue. So I don't know if I answered the question, but
I think they can get it. So again, the progesterone would actually help that, right?
It would, absolutely.
Okay. All right. So Ms. Carmen, go ahead and unmute for your question, please. Carmen, are you able to unmute? No.
Yes, I can unmute. Can you hear me?
Yes, go right ahead. One question, Ms. Carmen. Thank you so much.
Yes, I did fibroid surgery some years ago, but my fibroids grew back and I came back on your program late. Is there anything that I should not eat to prevent it from growing? I'm 63 and they said when I got older it would shrink, but I don't see it shrinking. My belly is still big like I'm pregnant, like I'm about 6 months pregnant.
Did you say you were 6 months pregnant?
No, my fibroids make my belly look like I'm 6 months pregnant.
Oh, fibroid. Okay.
3 years old.
Well, again, the fibroids are caused by estrogen, and again, the treatment for that would be if you're taking estrogen, to stop it, like birth control pills, and progesterone would help, to block the estrogen, and you can also ask your doctor for suppositories, progesterone suppositories, which would help also to help shrink the fibroid.
Okay, thank you.
Okay.
Go ahead. We're going to go and allow Candace to go ahead with the questions that are in the chat. Okay, so if you are overweight and you get on the progesterone, how would that affect you?
Well, remember, progesterone blocks insulin. Insulin is the hormone that puts on fat around the middle. Estrogen is a hormone that puts on fat around the hips, thighs, and buttocks. And when you have an underactive thyroid, that puts on weight everywhere. So what progesterone does, it blocks adrenaline, and adrenaline is what causes sugar levels to go up, and adrenaline causes release of cortisol, and cortisol also raises sugar levels. So So progesterone helps to lose weight both by blocking adrenaline and insulin, and also by blocking insulin. So it usually helps with weight loss. So again, I don't know if I answered your question. So.
Oh, it's okay. Candace, are you there?
I'm here. I'm looking through the chat at the moment. I feel like all of these questions were asked in real time or addressed already in one shape or form.
Okay. So we had someone ask about the suppositories. Would they asked, would that be regular suppositories? And you can answer that.
Well, these, what I was talking about was progesterone suppositories, and you could only get them from a compounding pharmacy, and they would require a prescription from a doctor. So, but they're very beneficial. You know, they're beneficial not only for women that have endometriosis and severe fibroids, but also women that have had miscarriages, women that are trying to get pregnant. You know, progesterone, a low progesterone is the number one reason why women have trouble getting, conceiving. And a low progesterone is the number one reason why there are miscarriages. And women that use progesterone while they're pregnant, if they continue throughout their entire pregnancy, they'll have a baby that's extremely intelligent and a very happy baby. You know, progesterone is wonderful for the fetus.
Okay, what would be the progesterone dose to block adrenaline?
It's the 5%, which is 50 milligrams. That's the exact strength you need to block adrenaline.
Okay. Go ahead, girly, unmute, please.
Hi, I was wondering which one, Dr. Platt, the bioidentical, is there a difference between that and just the Pro Max, or are they both the same?
Well, they're both exactly the same when it comes to progesterone. The Platt Pro has the oil of lavender and the Pro Max doesn't. That's the only difference.
Galaxy S8, go ahead with your question.
Hi, thank you. Can you hear me?
We can.
Okay, thank you. So I have this question, and it's very simple. How does one test to see if one has excessive adrenal levels? Is there a certain test that you take, that they take it to the lab or something, instead of just seeing if we have one of those symptoms on the list,
Right.
and then assuming, okay, I have a migraine, so I must have, excess adrenal levels or whatever. Is there an actual test that can be done?
The best lab test to determine if you have a high adrenaline is a morning cortisol, a cortisol level done before 9 o'clock. And the reason for that, remember adrenaline comes down around 2:30 in the morning, and whenever the body releases adrenaline, it creates stress, and the body responds to stress by putting out cortisol. And so a cortisol level done in the morning before 9 o'clock is the best test. Now, you cannot go by the normal level because the normal level goes up to 19.4. But anything above 13 or 14 is high, should be considered high. And that is but again, when it comes to hormones, I always prefer treating people rather than lab tests. And usually when people have excess adrenaline, you don't need a lab test to determine it. They grind their teeth, or they're quick to anger, or they carry tension in the back of the neck, they have cold hands, cold feet, anxiety. The only cause of anxiety is adrenaline. Road rage. I mean, so it's not subtle. When people have increased adrenaline, it's not hard to pick up. And if somebody is creative, then without doing anything, that they're going to have increased adrenaline. So.
Wow. Are there any studies for prisoners actually having high adrenaline?
No, but there's a good possibility that that they certainly do have high adrenaline. But, yeah.
Okay. And especially in the pandemic right now, are you guys seeing like more adrenaline problems?
No, I'm not seeing that, but not an increase. But you have to remember that adrenaline, causes the release of cortisol, and cortisol is very damaging to the immune system. So this is not a good time to have a damaged immune system. So that's another benefit of progesterone, is that it lowers cortisol levels, so it improves the immune system.
Sister Rose, someone in the chat wanted to know, how does a hormonal imbalance affect their ability to lose weight?
Well, weight, hormones control just about everything in the body, including weight. And you have a lot of different hormones that affect weight. You have insulin that puts on fat, like I say, around the middle. You have estrogen that puts on fat around the hips, thighs, and buttocks. You have thyroid that controls weight everywhere. Cortisol puts on weight around the middle. A lot of hormones affect weight. So, but it's not hard to get hormones in balance. It really isn't. But
I like the fact that you said it's not hard to balance them. And again, that would just be like with a 3 to 4 day dosage, probably, for a short period of time. Is that what you're saying?
Yeah, it doesn't take long to get hormones back in balance at all.
And what about if you're vitamin D? Because that affects a lot of things as well.
Well, I'm a big fan of vitamin D. And while we're talking about it, if people that take a high enough dose of vitamin D, and by high enough, I'm talking about 10,000 units, that people who take 10,000 units of vitamin D will never get the flu ever. And so not only does it prevent every flu there is, it doesn't prevent COVID, but it prevents people from getting sick from COVID and dying from COVID. So it basically is doing the same thing that the flu vaccine is doing right now, because all they can say is that it doesn't prevent COVID, but it prevents you from getting sick from COVID. But
So how long, I'm sorry, Dr. Platt, how long would you take vitamin D at a 10,000 level? Because they said it also affects your heart. So
well, every cell in the body has a vitamin D receptor site. And so vitamin D, I've never heard of vitamin D being bad for the heart. I don't know if that is what you're saying, but vitamin D, at a high enough dose of vitamin D, prevents 26 different cancers. It helps to prevent Alzheimer's. 10,000 units of vitamin D will prevent every sunburn, for those who might be interested about sunburn. And it helps prevent type 2 diabetes. Vitamin D, it's a nice vitamin. And vitamin D, by the way, should always be taken in a capsule with powder. The gel caps have oil, and oil impairs the absorption of it. They don't tell people that. They also tell people to go out in the sun to get vitamin D, but we stopped converting sunlight to vitamin D years ago. So I do like vitamin D.
So you recommend, this is amazing, you recommend the powder form as opposed to, and would it be D3 or would it be?
Yeah, vitamin D3. Vitamin D2 is synthetic. So vitamin D3, yeah. And also in combination with vitamin K and vitamin K2. And the reason for that is that one of the benefits of vitamin D, it puts calcium into bones, but it also puts calcium into blood vessels, which causes hardening of the arteries. Vitamin K2 prevents that from happening, and it takes calcium out of blood vessels and puts it into your bones. So vitamin D and vitamin K should always be used together.
Wow. And do you recommend a certain brand or no?
Well, my own brand. We have our own.
Oh, you sell vitamin D?
We do, yeah, the combination.
Okay.
Yeah.
All right. Okay. So we're going to wind up because we've kept you long enough. So if there are any questions, please go ahead, raise your hands. We're going to do this in about a 10-minute increment.
I just have one more in the chat about what do you do with someone who have massive headaches and migraines and sinusitis?
Well, I suspect that they have what's called occipital neuritis, which and that's a kind of headache that's always mistaken for migraine. And these are the headaches that arise from the occipital nerve sheath in the back at the base of the skull, and they can diagnose you just by pushing their thumb in that area, and it'll be very tender. And these headaches very often shoot right into the back of the eye, and they can cause what seems to be sinusitis, but it's not. And these headaches go away just by putting progesterone cream on the back of the neck.
Wow, I love it. Thank you so much, because that's important. Like a lot of people are walking around now with massive migraine. Can you talk just briefly? I know there's certain hands that just went up, but can you talk briefly about what we have not heard? And that is the diabetes. You said there was a third one. We always talk about 1 and 2, but
Well,
there's a third one.
Yeah, the type 3 diabetes. Type 3 diabetes is insulin resistance in the brain. And that means that the insulin has a real hard time in the brain getting glucose into the brain cells. And it's one of the most predisposing factors to Alzheimer's. And as I mentioned, that's why they're finding that coconut oil or MCT oil can actually cure this type of Alzheimer's. But coconut oil and MCT oil, as I mentioned before, is really good for the brain anyway. It's good brain fuel. So.
Okay. Also, is your vitamin D3, is it plant-based?
Is it what? I'm sorry?
Plant-based. Plant-based. Is it coming from a, he wants to talk to, it's okay. So.
I have 5 rescue dogs.
5, wow, okay.
And I should mention that progesterone is very good for dogs that have separation anxiety. Put it inside the ear, it'll go away in about 1 minute.
Okay. So someone also, oh yeah, let's go back to the vitamin D3. Is that plant-based?
Oh, plant-based.
Yes.
I don't think so. I think it might come from sheep. I'll have to find out.
Okay, so that's normal. A lot of it is coming from the sheep right now. All right. So if you try to use like straight lanolin on your skin, would it absorb also as the vitamin D?
I'm going to have to pass on that.
You got to pass.
That sounds like a rabbinical question. They ask the rabbi because they have the answer there. But
okay.
Yeah, I'm not sure. I tend to doubt it, but who knows?
Okay. All righty. Galaxy S8, go ahead and unmute.
Hi again. So I don't know if I heard you correctly, Dr. Platt, but you said something about how vitamin D, when we're exposed to the sun, we no longer, I forget the term, but our body no longer makes vitamin D out of the exposure of the sun. That's
exactly right.
Is that correct?
My practice is in Southern California, and for 30 years, I have never, ever had a patient that had a normal vitamin D level. They've done studies in Hawaii and Costa Rica, and everybody there is low in vitamin D.
Wow. So, in Costa Rica? That's amazing.
I mean, if you go back far enough, we used to make our own vitamin C. And right now, man and guinea pigs and fruit bats are the only mammals that don't make their own vitamin C. But I think things change. So I think we're changing. So.
If I could mention one more thing just about that same point, because I did hear that even those areas, like I've heard of areas that have high exposure and they're tropical areas, people can be very exposed to the sun and have excess exposure, and so you can deplete your vitamin D levels because of too much exposure as well to the sun.
That I haven't heard.
Okay, so someone mentioned that humidity decreases UVB absorption. Is that true?
Well, that may be. I'm not sure, but okay. I know that the one thing I do know is that oil will. So
okay,
yeah. So that.
Okay, so you don't recommend the oil form of the vitamin D.
Right.
All right, go ahead, Miss Yvonne.
Okay, I think that just answered my question because I'm taking a liquid 3 week too, and you mentioned about the oil. I didn't quite catch what you were saying. The oil versus
The oil
the
impairs,
powder. Could you please
yeah,
explain it again?
the oil impairs the absorption of it. So, so is you're the kind of thing like a dropper type?
Yeah.
Yeah.
Yeah, so like one drop is 1,000 units. So if you were to take 10 drops, that would theoretically be 10,000 units, but you may find that your blood level is only about 30 or 40, when it should be over 100.
Okay, thank you. All right, so we're almost coming to the end. Someone was asking a question in the chats. Are we able to see it, Candace? Okay, maybe
Sorry,
she
I was
can't.
having problems unmuting. I'm sorry about
Okay.
that. There was a little bit of a delay. They were saying that they didn't really quite understand what was said about the migraine earlier. And then someone asked about severe menstrual cramps in children.
Again, the only thing that will cause severe menstrual cramps in any age will be estrogen, and progesterone will definitely help that.
So with that, what you're saying, also someone asked earlier, I did notice that in the chat, and I just remembered, fibroids. They were asking, they wanted a natural version. They didn't want to go to the doctors. Is it possible to make a suppository out of your cream? Or is that, oh,
That's,
I don't
well,
know.
it could, well, theoretically, they could get an applicator. And yeah, they could. Absolutely. Yeah.
Okay. Thank you.
Interesting question.
Can I ask one question?
Yes. Someone was unmuting just now. I'm not sure. I think they wanted to ask a question.
Yes, I have a question. If you're taking Synthroid, would the progesterone cream affect you taking that? Would there be any adverse reaction?
No, absolutely not. They can certainly be used together.
Okay.
Yeah, that, how much Synthroid are you taking?
25 milligrams?
Microgram.
0.25.
Yeah, 0.025, 20, yeah.
Yeah.
Which is a very low dose. Yeah. So you probably,
okay.
Yeah. So I would assume that the skin on the back of your heels, that the skin is cracking.
Yeah, it's dry sometimes, yes.
Well, whatever. But yeah, you could take 4 times that amount very easily, probably. So.
Yeah, the ringing in the ears and things like this, a tension in the neck. I have a lot of that.
Well, if you have a lot of adrenaline, you won't tolerate thyroid. So, but once you lower the adrenaline, you could start increasing your thyroid.
Okay. Okay. Thank you so much.
And again, Dr. Platt, did you say that there is no side effects from overdosing on progesterone?
You know, I would like to say there aren't. There's only one, and that's when people have what's called type 3 diabetes, which is not common. What will happen is that progesterone will actually increase the amount of adrenaline that they have, and that'll happen right away. But what that's telling them is that their brain has a real hard time getting fuel. You know, so if that's the case, they should really get in touch with me. If they find they use progesterone and all of a sudden their adrenaline goes all the way up, that they get very anxious, they get palpitations and whatever, have them call me.
Okay. All righty. Thank you so much. We certainly appreciate you, and it has been a wonderful day today. There are so many questions, but they can ask you questions forever, I think so. So we don't want to keep you too much longer. I thank you for being here with us.
Okay.
Maybe on the last question, if you can just explain adrenal problems. So if someone has like a kidney ailment, would your progesterone help them?
Well, it won't specifically help a kidney ailment. It'll help people that have trouble with bladder issues like interstitial cystitis, or women with an overactive bladder. But it won't help the kidneys per se, though. Unfortunately.
Okay. Okay. Well, thank you. Thank you for everyone being with us.
Okay.
And Brother Fred, you're there. Do you have any closing comments?
For me or for Dr. Pratt here?
Oh, no, for you, because you've been quiet today, so it's okay.
I have been quiet. I think the only thing that I had to ask was, and I probably missed this part of the presentation, but are there some good plant-based foods that you would recommend for low, I can't even pronounce the word,
Progesterone.
You know, the progesterone comes from yam extract, but you cannot take yam extract and get progesterone from it. You know, that's done when it's manufactured. So there are no foods really that increase progesterone, none.
Wow. And I have heard that before as well, that we cannot ingest enough wild yam to actually take it, to get it. All right. Miss Candice?
That's all I had.
No, thank you.
Candace.
We're happy always to hear from the men because we have very few on the program. So there was Bill. I don't know if he can unmute. I think he had a question. Did you get your question answered, Bill? Maybe he's gone. Not sure.
No, I'm still here.
Oh, okay. Go right ahead and ask your question.
There was a mention of type 3 diabetes. Could you elaborate on that, please?
Well, again, that's insulin resistance in the brain, and it's a common precursor to Alzheimer's. There's really no test for it. The only test that can be done is Progesterone Cream, which will increase the symptoms of too much adrenaline. But the whole thing about Alzheimer's is it's a disease of prevention, and unfortunately, we live in a country where they don't allow preventive medicine, but that's the way it is. So I'm saying that if people do have type 3 diabetes, they should get in touch with me and I'll make some recommendations.
Okay. Someone actually talked about hazelnuts. Would that not help with progesterone levels? I know you said there's no food, but I just want to know. Hazelnuts?
That I haven't heard.
Okay. That's fine. That's okay. All right. Miss Candice, are you there? You have any closing comments?
No closing comments. Just thank you,
right.
Dr. Platt, for your time and your patience.
Yes. So Dr. Platt, you've helped all of us today and we're very grateful.
Okay.
Yes, because here it is that there's so many people with children. You said there's no such thing as adrenaline fatigue. You taught us a lot today. So we're going to get on our progesterone creams and hopefully it'll help all of us. No
Well,
road rage.
Sounds like a plan. Okay.
Yes, yes. So again, your website went up in the chat room for those who could not see it. If Candice, if you can read it one more time.
Sure, it's Platt. It's Dr. Platt's name, Platt wellness.com.
Okay. And someone wanted to know, how do they get a hold of you? Do you have an email address that they can?
I do. It's questions at plattwellness.com.
Questions at Platt Wellness.
Yeah.
All right. So did we get that? Questions at Platt Wellness. So we're going to go ahead and close out with prayer. Dr. Fred, can you help us with closing prayer? Dr. Fred? No, we're Dr. Fred.
I thought you were talking about my dad. That's funny.
Okay.
Heavenly Father, blessed Lord, we want to thank you so much for providing such valuable information for our health. We want to thank the presenter and those who have been instrumental in getting this information here. We want to thank you so much for all that you have done for us. Bless Dr. Pratt in his ventures, and we ask and pray these things in the blessing of your Son, Christ Jesus. Amen.
Amen. Thank you. Thank you so much, Dr. Platt.
Okay.
We appreciate you. Your
Okay.
transparency is wonderful. We love the entire program. Thank you.
Well,
Thank you.
Yes, thank you.
And people are thanking you as well
Okay.
in the chat room. I know you can't see that.
Okay.
Dr. Platt, I don't know how
Yes.
old you are, but your skin looks wonderful. So we need to follow along.
It does, doesn't it? I was saying that myself.
I was born at a very young age.
You was born at a very young age. Okay. I like that. I like that. But say hello to your wife. She looked very energetic as well. We never got to see her or speak to her, but thank you. Thank you. Thank you.
Okay.
All right. Have a great day.
Thank you for having me. Adios.